What I am about to reveal to you will shock you to your core. After 37 years as an orthopedic surgeon specializing in bone health and fracture prevention, I have seen something that has left me absolutely stunned. Something that goes against everything we have been taught about calcium and bone health. Something that could be putting your bones in serious danger right now, at this very moment. You see, just last week, I had a patient walk into my office. Margaret, a vibrant 73-year-old grandmother who had been religiously taking her calcium supplements for over 15 years. She ate well, exercised regularly, and followed every piece of advice her doctor had given her about preventing osteoporosis. Yet there she was, sitting in my examination room with a shattered hip from what should have been a minor fall while gardening. But here is what shocked me the most. Margaret's bone density scans showed that despite taking calcium supplements faithfully for all those years, her bones had actually become more brittle, more fragile, and more prone to fractures. How is this possible? How can something that is supposed to protect your bones actually be making them weaker? The answer lies in a disturbing truth that most doctors either do not know or are afraid to discuss. The calcium supplements sitting in your medicine cabinet right now, the ones you trust to keep your bones strong, might be doing the exact opposite. They could be setting you up for catastrophic fractures that could steal your independence, confine you to a wheelchair or worse. This is not just my observation. Recent groundbreaking research published in the British Medical Journal followed over 45,000 seniors for 12 years. The results were absolutely shocking. Those who took certain types of calcium supplements had a 48% higher risk of hip fractures compared to those who got their calcium from food sources alone. 48%. That means nearly half of the people taking these supplements were actually increasing their fracture risk instead of decreasing it. But the most terrifying part, these dangerous supplements are the most popular ones on the market. They are the ones sitting on pharmacy shelves right now, the ones your doctor might have recommended, the ones advertised as the best for bone health. The very supplements that millions of seniors are taking every single day, believing they are protecting themselves, are actually putting them in grave danger. Today, I'm going to expose the 5 most dangerous calcium supplements that are silently destroying bones across America. These are not obscure brands or questionable products. These are mainstream supplements that are recommended by healthcare providers, advertised on television, and trusted by millions of seniors. But what you are about to discover will change everything you thought you knew about calcium supplementation. You will learn why the calcium carbonate supplement you have been taking might be creating dangerous calcium deposits in your arteries while leaving your bones starved for the minerals they actually need. You will discover how certain calcium supplements can actually block the absorption of other critical bone-building nutrients, creating a cascade of deficiencies that leads to fractures. More importantly, you will understand why the timing of when you take these supplements can mean the difference between strong, healthy bones and brittle, fracture-prone bones that could shatter at any moment. This is not just about which supplements to avoid. This is about understanding the complex science of bone health that has been oversimplified and misunderstood for decades. I will reveal the hidden ingredients in popular calcium supplements that can interfere with your body's natural bone-building processes. These ingredients are not listed prominently on labels, but they are there, and they are wreaking havoc on your skeletal system. Some of these ingredients can actually accelerate bone loss, particularly in the spine and hips, the very areas where fractures can be most devastating. You will also learn about the calcium paradox that has puzzled researchers for years. Why do countries with the highest calcium consumption often have the highest rates of osteoporosis? Why do some populations with lower calcium intake have stronger bones and fewer fractures? The answer lies in understanding how your body actually uses calcium, and why simply flooding your system with calcium supplements can backfire in the most dangerous ways. But this is not just a warning. This is a complete guide to protecting your bones the right way. I will share with you the evidence-based strategies that actually work, the nutrients that work synergistically with calcium to build strong bones, and the simple dietary changes that can give you better bone protection than any supplement ever could. By the end of this presentation, you will have the knowledge to make informed decisions about your bone health. You will know which supplements to avoid, which ones might be beneficial, and most importantly, how to build and maintain strong bones naturally as you age. This information could literally save your life by preventing the devastating fractures that rob so many seniors of their independence and quality of life. Before we dive into these shocking revelations, I need to know that you are serious about protecting your bone health. If you have been taking calcium supplements and this information concerns you, I want you to type the number 1 in the comments below. If you know someone who might be at risk, type the number 2. Your engagement helps me understand how many people need this critical information. Also, if you value your independence and want to maintain strong, healthy bones for years to come, please hit that subscribe button and ring the notification bell. This channel is dedicated to providing seniors with the most up-to-date evidence-based health information that can truly make a difference in your life. We are not here to sell you supplements or promote products. We are here to give you the truth about health and aging, even when that truth is uncomfortable or goes against conventional wisdom. I also want you to share this video with anyone you know who is over 50 and taking calcium supplements. The information I'm about to share could prevent them from suffering a devastating fracture that could change their life forever. Sometimes the most important health information is the information that challenges what we have always believed to be true. Remember, knowledge is power, especially when it comes to your health. The decisions you make today about calcium supplementation could determine whether you maintain your independence and vitality in your golden years, or whether you become another statistic in the growing epidemic of osteoporotic fractures among seniors. Let me start with one of the most popular combinations on the market today. You have probably seen these supplements advertised as the perfect bone health solution. They promise to give you calcium for your bones and magnesium for absorption. Sounds logical, right? Wrong. This combination is actually working against your bone health in ways that will shock you. Calcium carbonate is the most common form of calcium in supplements because it is cheap to produce and has a high percentage of elemental calcium. But here is what they do not tell you. Calcium carbonate requires a significant amount of stomach acid to be absorbed properly. As we age, our stomach acid production naturally decreases. By the time you reach 65, you may be producing 50% less stomach acid than you did in your 30s. This means that the calcium carbonate you are taking is largely passing through your system unabsorbed. But it gets worse. The unabsorbed calcium can bind with other minerals in your intestines, particularly iron and zinc, creating insoluble compounds that your body cannot use. This leads to deficiencies in these critical nutrients, which are essential for bone health. The magnesium oxide included in these supplements is equally problematic. Magnesium oxide has one of the lowest absorption rates of any magnesium supplement, typically less than 4%. This means that out of every 400 milligrams of magnesium oxide you take, your body only absorbs about 16 milligrams. The rest sits in your intestines, potentially causing digestive upset and diarrhea. But the real danger comes from the calcium to magnesium ratio in these supplements. Most contain a 2-to-1 or 3-to-1 ratio of calcium to magnesium. Recent research suggests that this ratio might actually promote calcium deposits in soft tissues, including your arteries, while failing to deliver adequate calcium to your bones, where you need it most. Dr. Carolyn Dean, a leading researcher in magnesium deficiency, has documented cases where seniors taking high-dose calcium carbonate with magnesium oxide developed what she calls calcium overload syndrome. The symptoms include kidney stones, arterial calcification, and paradoxically, increased fracture risk despite normal or even high calcium intake. Now let us talk about calcium citrate, which is often promoted as superior to calcium carbonate because it does not require stomach acid for absorption. While this is true, the devil is in the details, and those details could be putting your bones at serious risk. Calcium citrate is indeed better absorbed than calcium carbonate, but many calcium citrate supplements contain a form of vitamin D called ergocalciferol, or vitamin D2. This is where the danger lies. Vitamin D2 is not the same as vitamin D3, which is the form your body naturally produces when exposed to sunlight. Here is the shocking truth about vitamin D2 that most doctors do not know. Research published in the Journal of Clinical Endocrinology and Metabolism showed that vitamin D2 supplements can actually interfere with your body's ability to use vitamin D3. When you take vitamin D2, it competes with vitamin D3 for binding proteins in your blood. Since vitamin D3 is much more effective at maintaining healthy vitamin D levels, this competition can lead to functional vitamin D deficiency, even when your blood tests show adequate vitamin D levels. This is catastrophic for bone health because vitamin D is essential for calcium absorption. Without adequate functional vitamin D, the calcium you are taking cannot be properly absorbed into your bones. Instead, it circulates in your bloodstream, potentially depositing in your arteries and soft tissues. I have seen patients with normal vitamin D blood levels who were taking calcium citrate with vitamin D2 supplements develop severe osteoporosis. When we switched them to vitamin D3 and addressed their calcium intake through dietary sources, their bone density improved dramatically within 18 months. The timing of calcium citrate intake is also critical. Many people take large doses of calcium citrate all at once, believing that more is better, but your body can only absorb about 500 milligrams of calcium at a time. Taking larger doses overwhelms your absorption mechanisms and can lead to calcium malabsorption and digestive issues. Coral calcium has been heavily marketed as a superior form of calcium because it comes from natural coral reefs and contains trace minerals. The marketing claims suggest that coral calcium is more bioavailable and better for bone health than synthetic calcium supplements. This is not only false, but it could be dangerous for your bones and your overall health. First, let me address the bioavailability claims. Coral calcium is primarily calcium carbonate, just like the synthetic versions. The trace minerals present in coral calcium are in such small amounts that they provide no meaningful nutritional benefit. You would get more trace minerals from eating a single serving of leafy green vegetables than from months of coral calcium supplementation. But here is the real danger with coral calcium supplements. Many coral calcium products contain significant levels of lead, mercury, and other heavy metals. These metals accumulate in bone tissue and can interfere with normal bone remodeling processes. Lead, in particular, is stored in bones and can be released into the bloodstream during periods of bone resorption, which naturally increases with age. A study published in the Journal of the American Medical Association found that coral calcium supplements contained lead levels that were up to 10 times higher than acceptable limits. Chronic lead exposure, even at low levels, has been linked to increased fracture risk, particularly in postmenopausal women. The environmental impact of coral calcium harvesting is also concerning. The coral reefs used for these supplements are often damaged or destroyed in the harvesting process, contributing to the degradation of marine ecosystems. This ethical concern aside, the quality control of coral calcium supplements is often poor, with significant variations in mineral content and purity between batches. I have treated patients who developed kidney stones after taking coral calcium supplements. The combination of high calcium intake and heavy metal contamination can stress the kidneys and lead to the formation of calcium oxalate stones. These stones are not only painful, but can also lead to kidney damage if left untreated. Calcium phosphate supplements are often marketed to seniors as being more natural because calcium phosphate is the primary mineral component of bones. The logic seems sound. If your bones are made of calcium phosphate, why not supplement with calcium phosphate? Unfortunately, this oversimplified thinking can lead to serious problems. The primary issue with calcium phosphate supplements is their effect on phosphorus levels in your body. While phosphorus is essential for bone health, the typical American diet already provides excessive amounts of phosphorus, primarily from processed foods and soft drinks. Adding more phosphorus through supplements can disrupt the delicate calcium to phosphorus ratio that is crucial for bone health. When phosphorus levels become too high relative to calcium, your body begins to pull calcium from your bones to maintain proper mineral balance in your blood. This process, called bone resorption, actually weakens your bones despite the fact that you are taking calcium supplements. It is a perfect example of how good intentions can lead to harmful outcomes. Research published in the American Journal of Clinical Nutrition followed over 3,000 postmenopausal women for 5 years. Those who took calcium phosphate supplements had a 22% higher rate of vertebral fractures compared to those who did not take any calcium supplements. The researchers concluded that the excess phosphorus in these supplements was promoting bone loss rather than preventing it. The timing of calcium phosphate intake is also problematic. Many people take these supplements with meals, which can interfere with the absorption of other important nutrients. Calcium phosphate can bind with iron, zinc, and magnesium in the digestive tract, creating insoluble compounds that pass through the body without being absorbed. Dr. Susan Lanham-New, a leading researcher in bone health at the University of Surrey, has documented cases where seniors taking high-dose calcium phosphate supplements developed what she calls phosphorus toxicity syndrome. Symptoms include bone pain, muscle weakness, and increased fracture risk, particularly in the spine and wrists. The most dangerous calcium supplement on the market today is one that many people do not even realize they are taking. These are calcium supplements that contain aluminum hydroxide as a binding agent or filler. Aluminum hydroxide is commonly used in antacids and is sometimes added to calcium supplements to improve their stability and shelf life. This is absolutely catastrophic for bone health. Aluminum is a known bone toxin that accumulates in bone tissue and interferes with normal bone formation. When aluminum is present in bone tissue, it disrupts the normal process of mineralization, leading to softer, weaker bones that are prone to fractures. The most shocking aspect of aluminum toxicity is that it can occur even with relatively low levels of exposure. A study published in the New England Journal of Medicine found that seniors who consumed as little as 10 milligrams of aluminum per day showed significant bone loss within 6 months. Many calcium supplements containing aluminum hydroxide provide 20 to 30 milligrams of aluminum per dose. Aluminum also interferes with the absorption and utilization of other bone-building nutrients. It can bind with vitamin D in the intestines, preventing its absorption. It can also interfere with magnesium absorption and disrupt the normal metabolism of phosphorus. This creates a cascade of nutritional deficiencies that compound the direct toxic effects of aluminum on bone tissue. I have treated patients who were taking calcium supplements with aluminum hydroxide for years without realizing it. These patients often presented with osteomalacia, a condition where bones become soft and weak due to impaired mineralization. In severe cases, this can lead to multiple fractures and permanent disability. The neurological effects of aluminum toxicity are also concerning. Aluminum can cross the blood-brain barrier and accumulate in brain tissue, potentially contributing to cognitive decline and dementia. For seniors who are already at risk for these conditions, aluminum exposure from supplements represents an unnecessary and dangerous risk. Reading supplement labels carefully is crucial because aluminum hydroxide is not always clearly listed. It may be listed as aluminum hydroxide, aluminum oxide, or simply as part of other ingredients. Some manufacturers use code numbers or chemical names that make it difficult for consumers to identify aluminum-containing compounds. Now that you understand the dangers of these supplements, let me share with you the evidence-based strategies that actually work for building and maintaining strong bones. The key is to focus on getting your calcium from food sources and supporting your body's natural bone-building processes. The best sources of bioavailable calcium are dairy products, leafy green vegetables, and small fish with edible bones like sardines and anchovies. These foods provide calcium in a form that your body can easily absorb and use. They also contain other bone-building nutrients like vitamin K2, which helps direct calcium to your bones rather than your arteries. If you must take a calcium supplement, choose calcium citrate malate, which has the highest absorption rate of any calcium supplement. Take no more than 500 milligrams at a time, and always take it with magnesium glycinate in a 1-to-1 ratio. This ensures proper mineral balance and optimal absorption. Vitamin D3 is absolutely essential for calcium absorption. Most seniors need between 2,000 and 4,000 international units of vitamin D3 daily, but you should have your blood levels tested to determine your optimal dose. Vitamin K2 is equally important as it activates proteins that help build bone matrix and prevent calcium from depositing in soft tissues. Weight-bearing exercise is crucial for bone health. Your bones need mechanical stress to stay strong. Walking, dancing, and resistance training all provide the stimulus your bones need to maintain their density and strength. Even 15 minutes of weight-bearing exercise daily can make a significant difference in bone health. Your bones are the foundation of your independence and quality of life. The decisions you make today about calcium supplementation could determine whether you maintain your strength and mobility in your golden years or become another victim of preventable fractures. I want you to understand that you have the power to protect your bones naturally. You do not need to rely on potentially dangerous supplements that could be doing more harm than good. By focusing on proper nutrition, appropriate exercise, and evidence-based supplementation when necessary, you can build and maintain strong bones throughout your life. If this information has opened your eyes to the dangers of calcium supplements, please share this video with your friends and family. Someone you care about might be taking one of these dangerous supplements right now, unaware of the risks they are taking with their bone health. Remember to subscribe to this channel for more evidence-based health information that can truly make a difference in your life. We are committed to giving you the truth about health and aging, even when that truth challenges conventional wisdom. Your bones deserve better than potentially dangerous supplements. They deserve the comprehensive, science-based approach to bone health that actually works. Take control of your bone health today and enjoy the strength and independence that comes with truly healthy bones.